Thank you so much, and good morning, good afternoon to those of you on the continent. I am director at Nest for Families, where we support parents through text messaging and also support community partners through our Nest for Communities program to leverage technology to increase their reach across communities. Welcoming an infant can be a surprisingly lonely and challenging time. While we say it takes a village to raise a child, few of us actually live in one. Nest began on the rugged and remote Big Island of Hawaii, and oh, sorry, I just want to check. Lena, next slide, please. So I'll wait for our slides to catch up. Thank you. We began on the remote island of Hawaii, and we've now extended to reach families on 6 islands. The majority of families we serve are Native Hawaiian or Pacific Islander, are enrolled in Medicaid, and live in rural areas. And we came to this work because so many of the families we originally reached at the hospital were off the grid, lived far from services, and many had limited connectivity. And what we hear from parents are like a parent who reached out early in our texting system to tell us there's nothing like feeling helpless when your baby is crying. And so parents are so grateful to have someone that they can reach out to over text messaging any time of day. If we're not available, then they get an autoresponder and they get a message back early in the morning. We began by offering trained peer support to parents after hospital delivery. Reaching out over phone for follow-up, but quickly integrated text follow-up in order to be there for families where and when they needed us most for support. Early in our years of peer support at Kona Community Hospital, we came to know a mom named Gina during some of the hardest moments of her life. She'd said goodbye to successive newborns during CWS removal at the hospital following positive drug screens. We didn't hear from Gina for a while, but at the height of the pandemic, a partner at Mental Health Kokua reached out to us about a chronically homeless pregnant parent struggling with behavioral health issues. This time, Gina, who we'd previously only been able to connect with at delivery, entered Nest's relationship-based texting in mid-pregnancy. After she enrolled, our initial messages were met with silence, but over time, a conversation unfolded. Gina let us know when she welcomed her newborn, she was reunited by CWS after a brief separation, and proceeded to text with us multiple times, some days, seeking support, but also sharing her successes as she navigated recovery and settling in her new home. At 6 months postpartum, she continued to breastfeed, secured long-acting contraception, and continues to navigate parenting and the juggle between self-care and recovery as she raises her toddler now. In order to work for families whom every day is a crisis, and for those newly thrown into crisis, relationship-based texting must reach those in need, and we need to remain engaged as needs evolve. Like a seatbelt or any preventive measure, relationship-based messaging needs to be in place, even when the need's not emergent, in order to be there when families are in crisis. The reason we chose semi-automated SMS texting is that the families we were reaching out to often didn't have data available. They may not have smartphones. There's no apps, data required. It allows families to engage with us when they're ready. And it supports a unique partnership between peer and clinical staff as we're able to coordinate on the back end in our platform and make sure that we're responding in meaningful and appropriate ways together. So our team, in order to bring this forth, our peer parent educators were supported by tech innovators, by cultural practitioners who have guided the development of our messaging and of our model. And we've had support from clinical experts in lactation, behavioral health, and child development to be sure that our messaging is evidence-based and appropriate to the communities we serve. I want to introduce Lena Henriques, who is our lead peer parent educator and a co-founder with me at Nest, and she'll tell you a little bit more about how we've evolved to support families over the last decade. Thank you.
Thanks, Krista. Thanks everyone for your time today. Yeah, I'm super proud of what we've been able to accomplish in the more than a decade, 11 or 12 years or so. We've been able to build and accomplish a lot. And our text messages are available in English, Marshallese, and Spanish. It's worked super hard to make that possible. Here you can see a lot of the stuff that makes our system work and make it reliable and secure and all of that kind of good stuff. And also we wanted to make sure that our messages were coming from an 808 number. So there was that level of familiarity for the local families. The key to our successful support has been establishing a trusted peer relationship, which is non-judgmental, culturally humble, and backed by professionals. So when I say no judgment, We like to support all moms, regardless of circumstance, because you can never tell which moms are going to come into crisis later, which ones are going to need help later. And so we want to just be there for all the moms across the board as a safety net. And many of you know that moms that don't qualify for certain programs might fly under the radar. And so this is important to us. We pride ourselves on presenting evidence-based information and referrals to professional support while also encouraging families to stay in touch with their culture and ancestors. This lets moms know that we respect them and their culture. And we've had opportunities in the past to consult with elders and cultural practitioners, and even have been able to share Olelo no Eao, or Hawaiian proverbs, with a lot of our families. And we encourage the usage and passing on of the home language to future generations. Access to professional guidance. So this normalizes and models asking for help and shows the importance of getting information from solid sources to our families. So as peer educators, we want to make sure that we're showing like it's okay to ask for help, and I'm going to do the same, and I'm going to get back to you with the answer to that question. This gives us more credibility too, lets the moms know that we're not basing information off of our personal opinions. From there, we continue our work by building rapport through continued and consistent support. So you can see an example of a conversation that we have with a mom. This is actually a message that really does go out to moms, just normalizing the hormonal changes and what they might be experiencing after they give birth. And a lot of moms, we get good response to this message. Moms are always like, yes, I'm dealing with that. What do I do? We're able to connect them to providers and help right away. Let's see. And so also we make sure that we respond consistently too, so that the moms know that we're a consistent in their life. Provider support and insurance plan support has made this even better, where we can make sure that we see what availability and capacity is and what is available to them depending on their insurance plan and their location. We're also able to give feedback back to providers and insurance plans to let them know what roadblocks moms are coming across. Relationship is further built by following up on their needs and being a steady presence in their lives. So while doing this, we help them address barriers to care. I kind of covered that a little bit in the last slide. But we circle back frequently and see if they connected to the support that they needed, and we scaffold the journey as needed. To do this, we utilize a custom dashboard that shows us which referrals we've made and which moms to circle back on to make sure that they receive the care that they were needing. We also have the ability to share alerts and opportunities. So timely alerts are able to be sent out based on community happenings. My favorite example of this is COVID. We were able to address that and not skip a beat, and let our moms know how to deal with what they were dealing with at those times. And then we're also able to let moms know if there are opportunities to have their voice heard in focus groups and leadership teams. So we've had pretty good success with getting our moms involved in that.
So we're super excited about the number of families we've been able to reach. Sustained connection with families has been possible for us using this technology for more than 4,500 infants. We currently serve about 700 families. And what that looks like on the day-to-day is that since launching our current texting platform in October of 2015, we've sent 525,000 outbound texts supporting parents. We've had more than 33,000 conversations addressing access to care, responding to families' needs and concerns. And we currently have about 5,000 infants and their families. Many families have been multiple participants now, and those are the families we've reached through texting. The thing that we are particularly proud of is that we have been able to sustain engagement with families at rates that are really unusual in the early childhood and perinatal sphere. About 50% of families leave home visiting before 12 months of age. And in our pilot, 93% of NEST participants continue to be engaged at 12 months of age. Parents' appreciation for NEST support is reflected in the many peer referrals we receive and our enthusiastic Net Promoter Score of 89. Tools on the back end that support this involve an ecosystem of world-class tools that support simple online enrollment and consent, provide staff a user-friendly dashboard, and allow rich reporting and data analysis. Here, you'll see a glimpse of a real-time participant engagement model that we share this with one of our oral health partners that we work with. It shares survey outcomes, demographics for the work and outcomes that we're in the midst of addressing in the field of maternal and infant oral health. Our system links demographics to our SMS survey data, allowing us to identify outcome disparities and opportunities for quality improvement. This gives you a quick glimpse of what the back end of our system looks like. We develop storylines that are now available in Spanish, Marshallese, and English, and integrate a tremendous amount of Olelo Hawaii as well. We also build a bank of answer templates for common concerns that we're able to collaborate on and have expert support available to craft new messaging, build answer templates, and new surveys. We'd love to put Nest to work for your members. We can partner with you in a number of ways in terms of affordable options for health plans. One option is a per member per month subscription. We also do some licensing and customization of Nest content and technology for partner use, and are especially experienced in the integration of partner initiatives within the Nest model of care, addressing the current 600 families that we serve. Nest texting can amplify your impact and lower costs. It allows for a seamless connection to telehealth visits with billable providers. Peer educators can act as provider extenders, care coordinators, and interpreters as well. We're able to utilize SMS texting to screen for behavioral health, domestic violence concerns. There's potential for billable behavioral health providers to use the texting platform for billable asynchronous communication as well. In summary, we just want to share what we heard from a parent recently. Some days are so much harder than others. It's nice to have someone to ask questions without having to feel embarrassed and checking in with me to make sure I'm okay, both physically and emotionally. I'm so happy that Nest is there. We'd love to connect with you over our texting system. You're welcome to text us now at 808-825-6774 so that you can join us in connecting more parents to accessible behavioral health support. You're also welcome to reach out to us at nestfamilies.org. We'd love to set up a meeting with you and talk about how we may integrate our tools. We are especially passionate about collaboration and would love to talk to partner projects about how we can use our knowledge to integrate support together. Lena, could you move to the last slide? Sorry for the noise. In closing, I just wanted to share an Olelo Noya that came to me today because of the potential for collaboration in this group. Ho'omoi vai kahi ka o'o. Let us all travel together like water flowing in one direction. We look forward to working together to meet the needs of families in Hawaii and integrate technology that hasn't maybe yet reached all of our families. Our passion is really about reaching those families least likely to ever be connected and served. And we'd love to answer some questions.